We have an eye-opening health report about a life-saving drug that many people don't seem to know about. It's called Truvada. It's a pill that some experts believe could end the AIDS epidemic. Local 10 News reporter Christy Kruger is in our newsroom with today's HealthCast.
Education is especially important right here in South Florida. Here's why. Miami-Dade and Broward counties lead the entire nation in new cases of HIV infection. So how does this drug work and who really needs it? Every year in the U.S., some 50,000 people are diagnosed with HIV infection. But this pill could be a game changer. Truvada, also known as PrEP, was approved 4 years ago. Taken once a day, PrEP is 90% effective at preventing HIV infection. Still, a CDC survey found many healthcare providers don't know enough about it.
You think about if we had a vaccine that worked that well, we would be so excited. And we don't have a vaccine, but we do have this medication that, when taken as directed, can do that, and it's amazing.
So amazing, in fact, that some potential users worry it's too good to be true.
Approve this.
Listron Mannix is HIV negative and wants to stay that way. He works at the Pride Center in Wilton Manors. The organization raises community awareness on a number of subjects, including PrEP.
My reason for getting on PrEP was that I wanted to understand more about it. I wanted, if I'm going to implement this in our community, I wanted to understand how this all worked.
PrEP works by establishing a presence of the drug in the cells that HIV targets, stopping the virus right in its tracks. But consistency is key.
It takes about a week for most men to have levels that are protective after starting the medication, and for women it takes longer. It takes about 3 weeks.
The bottom line is Truvada, or PrEP, is not a date-night drug. And that's what worries doctors. They don't want their patients taking a few pills, going out partying, and then thinking wrongly that they're protected.
But I think it could increase risky behavior, just the way being able to treat HIV infections today has changed the behavior, and it has increased promiscuity among populations who are at risk.
Dr. Ratson says the drug is intended for those in a monogamous relationship. Listron agrees.
It is empowering. I'm not sexually promiscuous. I'm not a Truvada whore, whatever stigmatizing terms that are out.
And eliminating that stigma continues. This season, PrEP went prime time for the first time on ABC's How to Get Away with Murder.
I'm on PrEP.
Back at the Pride Center, Listron says he is proof that HIV infections can be stopped. And PrEP is one big reason why.
Get tested, know your status, use it as prescribed. Please use it as prescribed.
Now, without insurance, Truvada or PrEP can run about $1,500 a month, but many insurance plans, including Medicaid, do cover it, and the drugs maker does offer assistance for people who can't afford that cost. Back to you.